Child falls and hurts their arm and they get sick in the middle of the night. How do you know what to do or if it warrants a trip to the emergency room? Dr. Justin Dockendorf joins me now with more on this issue. We appreciate you coming in today.
Sure. Thanks for having me.
Tell us, first of all, do you see a problem with people relying too much on the ER?
I do. I think for the most part, many of the common things that we see in the emergency room could be treated adequately as an outpatient through their family physician or family doctor.
Common, like could you throw a number on it? Is it every day that you see cases like that?
Probably at least 20 to 30% of the things that we see in the emergency room could be treated through their primary care physician.
Right, okay. So how do people know if it is a trip worth a trip to the ER?
Well, it all depends. I mean, you know, of course, severe things like sudden onset of chest pain or sudden headache or any type of pain anywhere in the chest or in the belly, bleeding uncontrolled, things like that. These are all true emergencies that need to be seen in the emergency room.
You mentioned bleeding, also vomiting that won't stop.
Vomiting is another common problem. Yeah. If it goes on for a protracted amount of time, then you need to be seen by a physician in the ER probably.
And you would think an obvious one may be loss of consciousness.
Of course.
Okay. What types of injuries would you say deem going to an urgent care facility or the primary doctor?
Well, I think urgent care is nice because minor scrapes and bruises, upper respiratory tract infections, you know, common cough, fever, things like that can be seen. Allergic reactions, poison ivy, especially this time of year, is very common. Things like that can be treated in an urgent care setting.
I also wanted to ask you about stitches because sometimes our cuts and abrasions may not look that bad, but they may need stitches. Who do you go to for that?
Well, again, it all depends how deep the wound is, where it's located. I think for the most part, you know, an inch or less, I think, can probably be, you know, seen at an urgent care facility. But anything deep or that continuously bleeding probably needs to go to the emergency room.
Do you think it's difficult for parents to make these decisions?
I think it is. I think it's easy to talk about, but when it actually happens, it's difficult. I mean, of course, when in doubt, the emergency room is the place to go. But I think you should at least think about going to an urgent care facility before the emergency room for common problems.
And what would you say to a parent who says, "Well, I just want to take my child to the emergency room just to be safe"?
Well, I mean, again, I think people that are trained to do urgent care medicine are very well trained and can handle most things that we see in the emergency room. And I don't think the quality of care is going to be any different if you visit an urgent care versus an ER setting.
Okay, Dr. Justin Dockendorf, we appreciate you coming in today.
Thank you.
Thank you so much. And for more